Dear Mike, you'll be happy to know that Jay is doing well at MIOT International. I'm glad we chose MIOT for his treatment, even if it meant traveling halfway across the globe to Chennai in South India. I've been exploring the hospital and am amazed by its impeccable standards. When I met the person behind it, I realized why.
In the last decade, MIOT has received patients from all over the world. In fact, from 97 countries. It is because these people have heard the success story of their friends who talk about the concern and care in the treatment of their problems in the MIOT hospitals. We have achieved this because of the excellent infrastructure, advanced technology, and men who are with a mission, dedication, and they treat patients not only with their brain but also with their heart.
In fact, it was my friend's success story and great experience at MIOT that brought me here. So I was not surprised to find things had started moving even before we landed. Our schedule had been carefully worked out by Ahmed, our interpreter and coordinator, who helped us with the formalities at every stage. We were to meet Jay's doctor, the orthopedic surgeon, the very next day. That was fast. As we went to see the doctor the next day, we met people from many different countries, and I thought of what Dr. Mohandas said. It was as though the whole world met here, and they all looked so comfortable. The Institute of Orthopedics is rightfully MIOT's pride. It is India's most successful name in joint replacement for hip, knee, shoulder, elbow, and wrist, a range that few hospitals can claim. They also have a renowned center for spine surgery. MIOT's concept of joint for life assures patients that their implants will last a lifetime. With over 35,000 replacements, it makes them the leading center across the world. The doctor told us we would have to do some tests and scans before the surgery. He was so thorough and confident that I was reassured about Jay's recovery. It's this thoroughness and obsession to give patients the best possible solution that gives me confidence in MIOT. For example, all diagnostics happen under one roof. This makes it convenient for patients and saves valuable time. The state-of-the-art lab and imaging facilities are manned by expert technicians who are sensitive to patients. The results are fast, accurate, and comprehensive, giving surgeons definite direction for treatment. That sounds like an emergency at the cardiac center. The cardiac center, once again, offers complete diagnosis and treatment, whatever be the disease. Specialists work in world-class cath labs using the latest stenting techniques to open up blocked blood vessels. Patients usually go home to normal lives within the week. Open heart surgery, if required, is done at the Center for Thoracic Surgery, which handles over 1,000 surgeries a year. To my pleasant surprise, I discovered that MIOT has a dedicated children's cardiac unit which handles even day-old babies. Driven by the energy and warmth of MIOT's chairman and backed by world-class equipment, the specialists at the center perform complex surgeries on children who travel from all over the world. I am sure that they have the good wishes of many thankful mothers. By the day of Jay's surgery, I was sure we had come to the right place. His surgery was done in one of the world's most advanced modular theaters. It was the latest minimally invasive surgery, which meant that he could walk within hours of the operation. And the ICU where he was shifted afterwards meets stringent global standards. When I heard Jay had taken those first few steps after surgery, I knew it would be okay. Here was a place where he would heal in both body and mind. I explored the hospital some more as I waited for Jay to return from the ICU. I recognized the similar pattern of cutting-edge treatment and care in the MIOT Institute of Cancer Cure. Patients can have all three modalities of cancer treatment under one roof at MIOT: chemotherapy, radiation, and surgery. It also offers the world's most advanced radiotherapy treatment with the True Beam that reduces treatment time from hours to minutes. It even targets moving organs without affecting surrounding tissue. This makes treatment much more comfortable for patients. In nephrology, MIOT is one of the few global centers to offer kidney transplants across blood groups. MIOT is also reputed for treatment of gastrointestinal diseases and surgery for obesity. Jay is back, happy and being looked after very well. He actually does exercises without complaining and is getting stronger every day. Tomorrow we leave. How swiftly time has flown at MIOT. As we came down to go to the airport, I realized that MIOT also offered something very important besides the world-class treatment. It was compassion. Compassion for the patient's condition, which underlined everything that MIOT did. In the story of MIOT's success lay Jay's and my own success story, and that of thousands of patients who come to MIOT International for treatment and go back home in fine health. MIOT International, putting patients first.